Dr. Patrick Hu from Moffitt Cancer Center. We're coming to you from Chicago, Illinois at the ASCO annual meeting. And we have the pleasure of being here with Dr. Fred Locke, expert in immuno-oncology. Thanks so much for being here today.
Thanks, Patrick. Glad to be back in person in Chicago at ASCO.
Well, actually, you started part of your career right here in Chicago, right?
I did. I trained at the University of Chicago, did my transplant lymphoma training, worked with Tom Gajewski, your friend, in the lab, learning about T-cell immunology, and glad to be pushing those things out to patients.
Well, you're really an international expert in CAR T therapy, so tell me where that's headed and what's new at ASCO this year.
Yeah, so CAR T-cell therapy is one of the things that we use to treat lymphoma, multiple myeloma, and I'm pleased to present an oral abstract here at ASCO talking about outcomes based upon race and ethnicity with CAR T-cell therapy for diffuse large B-cell lymphoma. What we learned is that the outcomes are different for patients who are Black or African American. The response rates are lower than patients who are white or Asian. And we really need to dig deeper into the disease biology and access to care, other reasons that we might see that effect.
What's your thoughts about the mechanism and what is it?
Well, what we find is that Black or African American patients are younger when they're getting CAR T-cell therapy. In fact, they tend to be younger overall at the time of diagnosis of diffuse large B-cell lymphoma. They generally have more aggressive disease, have had more prior lines of therapy, so that could be contributing to this. Also, it looks like there's an access to care issue. About 5% of patients treated in this huge real-world cohort, 1,300 patients we looked at, only 5% were Black or African American, and we think that about 8% of patients who have diffuse large B-cell lymphoma are Black or African American. So there's some disparity in access to care there.
What about moving CAR T therapy into solid cancers? Anything being presented at ASCO this year about that?
Well, there's certainly a lot of clinical trials looking at outcomes, or testing out new CAR T-cell therapies for solid tumors. It's still early days. There's no clear winner where we think this is the one, but it's one of the areas that we're really focused on at Moffitt, is to bring as many of these innovative clinical trials, get them started, early days, a few patients treated, and we hope there'll be exciting results in the future, but no major splashes that I've seen.
And one of the things is some of these T-cell therapies have some toxicities, and it's really need an expert, multidisciplinary team to take care of these patients. That's something we have at Moffitt Cancer Center, right? A floor that just does T-cell therapy.
Yeah, we have a team of experts dedicated to cellular immunotherapy, cell therapy treatment. That includes doctors who are experts in all different types of cancer, but they're also experts in cell therapy. And that team also includes nurses, pharmacists, cell therapy technicians, social workers, that runs the gamut, all with expertise in treating patients using these innovative therapies that have unique toxicities and unique ways of being administered.
Well, thank you, Dr. Locke, for being here with us today.
Yeah.
Dr. Fred Locke, immuno-oncology expert from Moffitt Cancer Center.